for this information gathering and physical assessment to be filmed and posted for access by faculty and students at the Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and this information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Thank you. For a background of my assessment and my patient, I'm a nurse working in an urgent care clinic in downtown Peoria. That came into my office this morning around 9:30, and I'm going to assess the chief's complaint. Zach, what brought you here today?
I've been having a cough and just having a hard time catching my breath.
How long has this been going on for?
About 4 days.
Okay, and tell me about your cough. Have you coughed anything up?
Yeah, I've been coughing a bunch of stuff up.
Okay, what color was it?
It was whitish.
Okay, was it thick or thin?
It was thick.
Okay, and then you said you've had a hard time catching your breath. What makes this worse and what makes it better?
If I'm like up, moving around, it's a lot worse, but if I sit down, it's better.
Okay. Well, first of all, I got his vital signs. His blood pressure was a little high, 132/80. His pulse was elevated as well. It was 130. His respirations were elevated at 28. Temperature was high. It was 102.8, and that was an axillary temp. And then his pulse ox was 92% over there. He said that's lower than it normally is, as far as he can remember. So Zach, since you're presenting with some respiratory symptoms, I'm going to go ahead and do a focused respiratory assessment on you and see if we can get a better idea of what's going on. I'm going to begin by kind of inspecting and assessing his breathing, if he's using any accessory muscles, is he, retracting at all with his respirations, which he's not, but my patient for the project is having some subcostal retractions and some abdominal muscle use with each respiration. I'm also assessing for symmetric chest expansion. I want to see both sides of the chest equally rising and falling with each breath, which his are. And then I just want to see, overall, does he look fatigued with breathing? Is it wearing him out? All right, I will then move on to palpation. While I'm palpating, I'm assessing for any masses, any nodules, any lesions, anything abnormal. I'm palpating all areas of the chest, anteriorly and posteriorly as well, looking for any abnormalities. I don't see any. I will then move on to test for chest expansion. I'd like to see symmetrical chest expansion with each respiration. Zach, I'm going to ask you to take a deep breath in and out. Okay, thank you. Do that on the posteriorly as well. Okay. And with that, I was just assessing to make sure that his chest expansion was equal on both sides, and that I could tell that by my fingers drifting apart when I placed him on his chest. I'm going to move on to assess for tactile fremitus, which would assess for areas of consolidation or obstruction. It would kind of pinpoint where those areas are. So every time that I move my hand, I'm going to ask you to say 99.
99. 99. 99. 99. 99. 99.
I'll do it posteriorly as well.
99, 99, 99, 99, 99, 99.
So for the assessing for tactile fremitus, I essentially moved my hand up and down both lung fields, and I was assessing to make sure that when he said there were 99, the vibrations that I felt were equal and palpable in all fields, and they were. So that's good. I will move on to percuss, his respiratory system. This additionally assesses for areas of consolidation or obstruction. I'll do it posteriorly as well. As with tactile fremitus, I moved my hands among all areas of all the lung fields just to assess to see how he passed that assessment. Normal, healthy lung tissue that has no consolidation or obstruction is going to be resonant, which his was, so I was not able to pinpoint any areas ventilation or obstruction. I will now move on to auscultate your lung sounds. I will use the diaphragm with my stethoscope. Each area, so I'm going to listen to anteriorly and posteriorly, and I want to listen to a full respiration each time I move my stethoscope. So every time that I move the stethoscope, I'm going to ask you to take a deep breath in and out, okay?
Okay.
Well, Zach's lung sounds are actually clear and equal through all fields. For the purpose of this assignment, the patient had inspiratory and expiratory wheezing noted. The lung sounds posteriorly were decreased through all fields, but anteriorly he had right-sided crackles. His left side anteriorly was decreased. And while I was auscultating his lung sounds, I was once again, assessing for any accessory use, any abdominal muscle use with his respirations. I was looking for any retractions anywhere. I was assessing for a cough, and if he did cough, did it clear up? Did his lung sounds clear after his cough? Which he did cough, and they did not clear afterwards, and he didn't cough anything up while I was here. I am going to ask you a few more history-related questions that are related to your respiratory system. Do you smoke at all?
Yeah.
How long have you smoked?
About 15 years.
Okay. And how much do you smoke?
A pack a day.
Okay. Have you ever tried to quit?
Yeah, once.
Okay. And how long did you quit for?
About a month.
Okay. Well, before you leave, I'll give you a packet on smoking cessation. We'll go over it and resources available to maybe help you quit smoking, okay?
Okay.
Do you have any allergies?
Yeah, just like seasonal allergies.
Okay. Is there anything specific that triggers them?
Well, like if I'm out in the yard, sometimes I get itchy. I'm also allergic to cats and dogs.
Okay. What happens when you're around cats and dogs?
I just get itchy.
Okay. And that concludes my focused respiratory assessment.